In less than 3 years, opioid overdose deaths are up, get this, 218%. So this is according to the Georgia Department of Public Health.
Well, now a small company in Kennesaw is hoping to lead the way in the battle against the opioid crisis. And it starts on the operating table. Caitlin Ross reports Softwave Technologies just secured a patent to use sound to keep people safe from opioid addiction. So Caitlin, how does this work here?
Yeah, it's a really interesting technology. This isn't a new therapy. Doctors have been using sound waves or shock waves to break up kidney stones since the 1980s. But the idea to use the sound to help people cope with pain instead of opioids is brand new. It looks strange, but John Warlick says this is the sound of relief.
It's just such simple it's sound waves. It's thunder and lightning.
He's worked with the technology for years to help people regain range of motion, heal old injuries, even remove tattoos.
And the sound waves have 4 different kinds of energy that we have: heat, electromagnetic, acoustic, and light. And I know this sounds cheesy, but it sort of adds up to heal.
The device delivers quick pulses when applied with ultrasound gel to the skin.
We essentially fool the body into thinking it's been injured, and your body heals itself.
He's used to patients experiencing relief from pain after the treatment. But he says after he started reading more about the opioid crisis in the U.S., he wondered if they could stop the pain before it starts. The Department of Health and Human Services estimates 2 million Americans become addicted to opioids each year.
And so we just started thinking about, how could we help?
He applied for a patent to get Softwave Technologies into the operating room to help heal patients before an opioid is ever prescribed.
Many of these patients became addicts because of a painful surgery or of an injury or a slip and fall.
Dr. John David Mullins practices at Piedmont Hospital in the Shepherd Center and uses the treatment consistently to help his patients avoid addictive medication.
We all have in the back of our mind, we have a great fear of starting someone down the path of opioid dependence.
The idea is that if there's no pain in the first place, the patient will never need to take it.
Really, I can't believe nobody else had thought of it first. It was this really, really simple application of this really low-tech technology.
And this might be a hopeful estimate, but Warlick says if they were able to get into every surgery that would eventually require an opioid for pain management after healing, and the doctors used this instead, they could cut the number of opioids prescribed by half in the country.
All right, so if this is for pain management, what does this treatment actually feel like, and does it hurt?
Yeah.
Okay, it's not without pain. They actually did it on me on an old knee injury so we could test it out and see how it feels. They asked me to do a scale of 1 to 10. I'd say it was maybe a 4, and the treatment only lasts 5 minutes. He says you have to get it done a few times and then you start really experiencing pain relief. So this could be a game changer when you're talking about chronic pain that ends up getting people into that opioid addiction.
Man, amazing technology. Hopefully that it works,
I hope
for
so.
a lot of patients in the future. Thanks, Caitlin.
Caitlin, thank you.